Anterior horn of lateral meniscus tears are rare tears, but these are prone to rapid progression and acceleration of lateral sided arthritis of the joint. Here we can appreciate that there is a anterior horn of lateral meniscus tear, and these injuries will lead to a very quick progression of lateral sided arthritis. These injuries should ideally be always repaired so as to slow down the progress of osteoarthritis and prevent the knee from further damage. Conventionally, these tears were not recognized and not addressed at the right time, but now we have got techniques to address these tears properly and to prevent the late onset osteoarthritis. Here, what we can appreciate is the loss of a normal looking anterior horn of the meniscus and shifting of the meniscus, that is called as meniscus extrusion on the lateral side. This is rare as compared to the medial side, but it happens. Now there is a special anchor which is called as an Osteoknot X. This is a low profile all suture anchor which can be used to repair these kind of a bad tears. So what we do is we put an anchor, it's an all suture anchor, and then we repair the anterior horn of the lateral meniscus using the ideal suture shuttles one by one, and what that will do is reduce the meniscus anterior horn back into its place by performing an anterior root repair. So this will not only have good forces which are transmitted, but it will also slow down the chances of osteoarthritis that may happen. So what we need to do is we need to just pass the sutures sequentially one by one, thereby covering the whole of the anterior root. So what we can do is we can take one white suture, one blue suture at a time, and then we can take one white, one blue suture, and in the end all these sutures are repaired to obtain a very good anterior horn of lateral meniscus repair. So these kind of problems, these kind of injuries should be have a high index of suspicion and repaired at a proper place, and if you repair them at a proper place, the patient will have good result and probably some added years of life. You should also check alignment in these cases, and if the alignment is not proper or not good, you might consider doing a osteotomy as well. Here we found that still the tear is not well reduced, so we use one more anchor and we used a double row technique to repair this meniscus back into its place. So in the more medial sided anchor, we just take a simple stitch, thereby reducing the meniscus anterior horn back into its place. So basically what we have performed here is a double row repair of the meniscus using two Osteoknot X anchors and almost what is called as a double row knotted repair without using a knotless anchor, and this usually puts whole of the anterior meniscus horn or the anterior root into its position and leads to a very normal biokinematics of the knee, preventing osteoarthritis. What you can appreciate here is there is a dent like structure on the cartilage which is due to unequal force distribution which was prior to that, and here you can see that whole of the anterior root is now very solidly repaired to the meniscus, and you can just clean out the parts of the meniscus which are